Being a mum means caring for your children and making sure that they're healthy and safe as they grow. I look at my little one, yeah, and I know that before I know it, he'll be off in secondary school. Now, healthcare professionals will tell us that vaccines are the best way to keep our families and children safe. But many of us in the roaming traveller communities have grown up without them, including me, and we have genuine concerns about how safe they really are. So what's best for our children? I've gathered questions from Romani traveller parents across the UK, and I'm going to meet 2 healthcare professionals to get some answers. Hi, I'm Liza, I'm a Romani gypsy and a mum.
Hi, nice to meet you. I'm Vicky.
I'm Becky.
We're clinical managers and both registered nurses with a specialism in immunisations and vaccinations. We work for Kernow Health CIC, part of the NHS.
And we provide healthcare across Cornwall and Devon, and we work closely with our local traveller communities.
Well, thanks for coming to speak to me today. I have a few questions that I've gathered from Romy and traveller parents. So my first question to you both is, how do vaccines keep young children safe? I worry that the vaccines give the children the illness.
Vaccines work by giving your child's immune system the opportunity to learn how to respond to a particular disease or illness before they come into contact with the real illness itself. So vaccines contain a very small amount of the disease, illness or virus that we're protecting them against at a level that's not going to cause them any harm, that allows the body to start learning what to do in response to that virus. It's armoury for your child to keep them fit and healthy if they do come into contact with that virus or illness in the future, to keep them safe and healthy.
You can't actually get the illness from having the vaccine, and you've just got to weigh up the fact that actually getting the illness itself would be far, far more serious. So it is worth vaccinating to protect them.
There are 11 vaccines for 1 to 15-year-old children on the NHS vaccine schedule that I can find. Now, that sounds like a lot of jabs. Do they really need all of them?
So it sounds like a lot when you look at it when they're all together, but those are all offered over a number of years as the child is growing up. It's important that your child does receive them all. They all protect against different diseases or viruses, and they're carefully scheduled to protect your child at certain ages and stages of their life and their immune system as it grows. So it's really important that they do receive all the vaccines. It's never too late to start the vaccination process. If you haven't started already, you can start at any point in the child's lifetime. It's just important that you receive them.
What's the likelihood that a child in secondary school will be exposed to any of the illnesses that the jabs are supposed to protect them from?
So it is likely that they will come across them, because some of these diseases are circulating in the community. Some have been eradicated because of the vaccination programme, and some can't be eradicated. For example, spores in the ground where you can get tetanus. So it is really important that they do have the vaccinations that are due in secondary school. It helps protect themselves. It also protects the wider community. So perhaps people who are unwell or older, whose immune response might not be so good, it can help stop these diseases spreading in the wider community, as well as keeping them safe.
What about side effects? I worry I may be gambling with my child's health.
Generally, all medication has some side effects, and with vaccines, there are some very common ones that about 1 in 10 people will get, like having a sore arm, a bit of a headache, and they're easily managed and resolve readily. There can be more serious side effects, but they happen in about 1 in a million cases where you might have an anaphylactic reaction, but all staff are trained to deal with that and can easily manage it during the appointment.
And those emergency situations will happen very quickly after the vaccination if they do occur. So please be reassured that we are trained and able to manage those situations safely and effectively. As for side effects, do you speak to your health professional or whoever you feel trusted to speak to about vaccinations, about any family history of allergies or concerns that you might have prior to the vaccination? It's important that we know your concerns or any history of allergies that we can look into and talk with you about so that you're confident in any possible side effects that might occur.
And it's just worth remembering that any of the side effects are not as bad as getting this potentially serious illness. So it is worth being vaccinated.
A lot of parents want to be reassured that vaccines do no harm and to know exactly what ingredients make up each vaccine. Can NHS professionals provide this reassurance and properly inform the parents?
Absolutely. I'd encourage parents to speak to a member of our team or an NHS professional that they trust, GP, practice nurse that they trust. We have information that comes from reliable sources to share with you about the ingredients, the side effects, the benefits of the vaccination. And we can deliver that to you in different formats to suit you, videos, leaflets, or having that conversation with us and building those trusted conversations with each other about vaccines.
The best time to go through it really is, just before you're due to have a particular vaccination, because there are lots of ingredients that are different in each vaccination. So rather than giving a list of everything that you might possibly have, it's best to think about what's in the vaccination that you're due. And people might want to go away and think about it for a bit and come back, and they might have more questions, and that's absolutely fine. Everyone needs to feel comfortable and have all their questions answered before they have their vaccination.
There's no pressure to have that vaccine that day. We want you to feel comfortable and informed about what your child or yourself is receiving. So take the time to digest that information and come back with questions if you need to.
For the parents out there who homeschool their children, how did they find out when and where to get the vaccinations done?
So a list of age by vaccinations by age is available on the NHS website. If they look there, they can see which vaccinations are due when. You can also speak to a GP, practice nurse, if you're able to, about the vaccinations, or a member of our team is more than happy to go through that with you. If you're due a vaccination and you're unsure, if you've not received any others or you're not up to date, then it's never too late to vaccinate. We can bring your child up to date with the schedule as much as possible. Have that conversation with your health professional.
Yeah, people might have a red book at home that gets issued when you have a baby, and that lists out everything that's due from the time they're born up until they're 18. So it's quite a good starting point to look at.
In the scenario of people being scared of needles, so my child is, or I am scared of needles, is injections the only way? If so, how can I help navigate this fear?
So it's perfectly normal to have a fear of needles, and we're fully trained and in managing and used to managing people that are fearful of needles or health situations. Most vaccinations are given as an injection into the upper arm, but some vaccines, like the annual flu vaccine for children from 2 to 15, are given as a spray up each side of the nose. So that's quite simple and pain-free for them to have. We're, like I say, really well trained in managing those situations. It's again having those conversations with us about your fears and anxieties so that we can work together to alleviate that fear, or at least minimize it and make you feel comfortable in receiving that vaccination on the day.
Sometimes people need to come back a couple of times, so it's not unusual for someone to be booked in for a vaccination, and actually they need to just have a chat about it or see, what it's going to be like, and they might go away and come back again at a later time, and that's fine. We understand that. That's fine.
I suppose it's about relieving that pressure that it has to be done then and there due to a schedule or due to an appointment. Like, it doesn't have to be that way.
Yeah, there's no pressure. the first step is coming to meet us and feeling comfortable. If there is a fear of a particular part of the vaccination process, let's work together to make sure we can make that minimise that impact and make you feel comfortable.
My final question to you both. I don't always trust what I hear. Why should I believe you?
That's a really good question. There's a lot of information available online and social media about vaccinations or other health-related things. We are registered nurses, we're trained in immunisation, that's our speciality. We receive all of our training from reliable sources. All our information that we give you comes from research-based scientific information. We can deliver you the information in a format that suits your needs and make you feel comfortable with the information that we're delivering by getting to know us and having confidence in the resources that we're providing you with.
Yeah, we're happy to answer any questions you might have, anything you've heard about them or read about them, to try and dispel any myths or fears that you might have, using the sort of the research that's been properly tested and evaluated.
And like I said before, there's no pressure for you to have the vaccination at that point. If you want to come and talk to us about the vaccine, or you have specific concerns that you've maybe read online or heard that you want to discuss, then please do come and contact us. We can have those conversations and you can go away again and have a little think before having the vaccination.
So we know health centres can be really busy, but there is always somebody that's designated to deal with vaccinations. So if you don't initially get someone to answer your questions, you can always ask to speak to someone who deals specifically with vaccinations, usually a nurse in the practice, and they'll be more than happy to help.
Or you can speak to a member of our team, and we're more than happy to speak to anybody about vaccinations and answer any questions or concerns that you might have.
Oh, that's great. Thank you both for answering my questions today.
Thank you. Thank you.
I'm really glad I got to speak to Vicky and Becky today. It's really important to have these conversations, and it's right to ask questions when it comes to the health of our children. We've heard from the specialists and got some straight answers to the things that matter to us. If you want to dig a bit deeper, have any concerns or more questions, please get in contact with your local healthcare professionals. At the end of the day, we all want the same thing, for our children to be safe and to have the best start in life.